Good afternoon, everyone. I'm Tom Stolz, the County Manager, and I'm here today to talk about the Sedgwick County COVID-19 daily update for April 23rd. And as usual, we'll go through the numbers very quickly. The number of confirmed cases in the United States of America increased from 826,248 to 845,959. That is an increase of 19,711 cases and a 2.4% increase. In the state of Kansas, we went from 2,211 cases to 2,482 cases. That is a increase of 271 cases and is a 12% increase. The number of deaths in the state of Kansas is now standing at 112, and the number of cases in Sedgwick County increased from 295 to 316. That's an increase of 21 cases, or a 7% increase. Our periphery counties around Sedgwick, Harper County has 5 current cases today. Butler has 13, Cowley with 1, Sumner with 3, and Reno with 16. Of the 316 cases in Sedgwick County, we have 144 recoveries and 6 reported deaths at this time. The health department update, the criteria for testing has been revised, as we've talked about a couple of times this week. Residents can be tested if they have at least 2 symptoms of COVID-19. There are no longer restrictions on age or underlying conditions. KDHE reports that as of noon today, April 23rd, more than 2,800 residents have been tested for COVID-19 in Sedgwick County. The health department is currently taking samples of residents who meet the criteria to be tested for the disease at no cost to the residents. There were 37 people scheduled to be sampled by the health department today. And any resident who has symptoms or would like to be tested should start the process by calling 211 and go through the initial screening process. And for any update of information, please visit www.sedgwickcounty.org. The current orders in place, the governor's order banning gatherings in excess of 10 people is in place till May 1st. The governor's stay-at-home order is in place till May 3rd. As many of you know, the County Board of Commissioners yesterday talked about a review of plans, very high level at this time, to reopen businesses and organizations in Sedgwick County. We are meeting tomorrow morning at 10 a.m. To have further discussion with the business community regarding potential opening of businesses in Sedgwick County. That meeting can be accessed via Facebook Live or YouTube Live. Starts at 10 a.m. We think it'll probably last an hour to 90 minutes. With that, just want to mention again the increased testing. We'll begin to continue to work on our website to try to put meaningful data out to follow and track the infection rates and to put as much data out as we can possibly for the community to stay abreast of what's going on. So with that, I will conclude and we'll see everyone tomorrow. Thank you.
Yes, I have a question from KSN at Rachel at KSN. I know some of the counties, for example, Ford County and out in Southwest Kansas, they have now started testing asymptomatic people who may have had connections or have been exposed. Is that something that Sedgwick County is considering, or are you waiting on guidance on that?
I don't know that we're waiting on guidance. We're waiting on enough test kits to do that. I think we're very interested in doing something like that. And when we get the number of test sample kits in and the capacity at the state level to run the tests, that's something absolutely we're interested in doing.
Jacob Albrecht at KWCH. Yesterday, I talked to some people at the county that talked about PPE for businesses being a big part of potentially reopening. Is the county looking to provide some PPE, or what kind of guidance, or what can businesses do right now to get that kinds of things? What should they be looking for if that's going to be a part of them opening back up?
That's a really good question, and that's part of the discussion that we're having with the business community now. And we actually have been for a week or so, a couple weeks with them. But clearly, our recommendations moving forward, and of course this will flush out over the next week to 10 days, but social distancing and sanitation, hand washing, disinfecting surfaces, that's all going to be a critical part of the reopening. The use of masks is important, particularly when social distancing becomes in jeopardy. So if you're in an environment where you can't maintain the 6 feet of space, then I think masks become a viable alternative for both customers and workers in that kind of environment. To answer your first question, we are very interested in obtaining masks for the general public. The county would look at doing that. But with PPEs, it's just such a struggle to get them right now because everybody in the world literally wants them. So we're having trouble with supply. We've had trouble with PPE supply from day one with first responders and medical people. And I think moving ahead, we need to think about PPEs for citizens. There's a lot of people homemaking masks right now, and there are some guidelines online on how to make an effective mask, many sources to reach out to do that. But the county is trying to acquire surgical or paper masks that we could potentially give to members of the community to be safe. Another thing that's in short supply right now are if you're running a business and you have a large number of employees, maybe a temperature thermometer testing device would be a good idea. Again, there's a delay and a wait to even get a simple thermometer today because of what's going on in the world. But those are the kinds of things that businesses should be thinking about. And I know they've been thinking about it for the last couple of weeks. And as we wind down, whatever date the stay-at-home order comes off, be ready to implement and be effective in protecting not only your workers, but customers who come in.
Hey, Tom, it's Greg at Cake. How much advance notice are businesses going to have if they have to stay closed longer? I mean, is there a date where you're going to say, yes, open your doors with these restrictions, or no, we've got to do this for another week, 2 weeks, whatever?
It's a really good question. We're kind of waiting to see what the governor's going to do with her stay-at-home. Clearly, if she would come in and extend, then anything that the county would or would not do would be moot at that point. So we're kind of waiting to see what she does. But we clearly, our intention is to give businesses as much notice as possible with good news or bad. We're trying to wait, though, to get as much data as possible to make a good decision, get as much testing done as we can, and kind of wait to see how the next week goes. But clearly, if we want to send a message out that they would be able to do some partial opening, we would love to give them a week or two of notice on that. It's part of why the commission talked about yesterday maybe having a special meeting Monday to keep this moving so we could give as much notice, good or bad, to the business community of what's going on. But even before we do that, I think we have to wait on Governor Kelly and see what she decides with her stay-at-home.
Is it premature for businesses and establishments to start scheduling appointments? Because we're starting to see those emails already.
You mean scheduling appointments for customers to come in?
Yeah, like I'm thinking like hair salons. Like the place we go to is already starting to schedule appointment. They're making it clear that it's tentative. But is that premature?
Again, it depends on what the governor says. If the governor's stay-at-home order ends on the 3rd, and the commission and Dr. Mins don't put an additional stay-at-home order on, then I think that if appointments are being made for after May 4th, I think that's somewhat prudent. I think that we'll look at data, and we're in a window at earliest that we can consider clearly as May 4th because the governor's order is the rule until then. But even if the county or Dr. Mins extends, we know that, and we're hopeful that the data is going to show we're on the downward cycle of this and that we have at least some PPEs and businesses have a pretty good plan going forward, which we'll be doing that over the next couple of days, working with businesses to develop good plans. But if it goes back to May 15th or May 12th, clearly it's time now to be thinking about getting appointments and getting next steps moving forward to open. I think that would be prudent.
Tom Jacob at KWCH again. It's kind of turned into a political mess in a lot of places, but is there consideration, or have you guys discussed at all the possibility of requiring masks in certain spaces? Is that something you're even interested in getting involved with?
Well, you know, if you took the limitation of PPE off the table and the limitation of testing off the table, this whole conversation would be very different. But the reality of it is there is a shortage, so I don't know how we could require our citizens to do something that they can't achieve. They can't get a hold of masks. I think it's very prudent. I mean, there's a lot of data out there that shows that if two people are in a room and they can't maintain social distance, that if they're both wearing masks, there's a very high percentage that they're not going to transmit the virus. I think that's prudent action. And I know that businesses, if they can, will consider that, but it's all about obtaining the materials and the PPEs to pull that off. We haven't had any discussion about a mandating here. Not saying we won't in the future. It depends on the track of the virus, and it depends on how much we want to open it up too. I will tell you though that we're limited because of a lack of PPEs on how much we open for business and the kinds of restrictions that the commission would have to consider. Clearly, if we had ample PPEs, we could maybe have a better gathering size than maybe what we'll be able to go forward with. But it all depends on that supply of that product.
Are businesses allowed to require that legally themselves?
That's a great question that they'll have to probably consult with their own attorneys on. I think each business will have to ask that question internally.
Okay,
And
folks.
if there are people that, let's say they want to open up quickly and they want to make some masks, can they give those to you guys? Like, is there a spot that could go to general opening up PPE if people have it or want to donate it?
Yeah, we're always interested in anyone that can manufacture locally here, any PPEs from masks to hand sanitizer to gloves. And there is a number and a contact we can get them into contact with to produce that kind of supply for us. Absolutely.
All right, folks.
Okay, yeah, if you guys could send us that number, we can distribute that too.
Very good. We will.
Okay, we've got to wrap up. Tom has meetings to get to.
All right. Thank you all. Appreciate it.
Just have one quick question. Is it fair to say the PPE is the biggest issue you're facing in terms of deciding to reopen?
Well, there's three issues there on the reopen. PPE is definitely one. I don't know that's the most important. The amount of testing is critical. And the third thing is we got to know where we're at in the infection rate, whether we are at what they call the top of the curve on the way down, or whether we have flatlined it and we're flat and maybe decreasing. Those are the three things I think the commission will have to weigh up. Dr. Mins will have to weigh up. So I don't know that any one of those is more important than the other, but all three of them are critical. Okay. Thanks, guys.